Now within the general pharmacology, after having discussed about the types of receptors, now let me discuss the next topic in the general pharmacology, that is dose response curve, right. So the next topic for the discussion is the dose response curve. Right, the dose response curve. Now if you take this particular dose response curve, this is also called DRC, right, dose response curve. Now what exactly is your dose response curve? Remember, it is a graph between the dose of the drug which is administered on the x-axis and the effect that is produced by the drug on the y-axis. That is called as the dose response curve. Okay, so remember, it is the graph, right, it is the graph which is drawn between, right, which is drawn between dose of a drug, right, and the dose of a drug which is administered is on the x-axis, right. It is the graph between the dose of the drug administered on the x-axis and, right, and the effect produced, right, and the effect produced by the drug, right, the effect produced by the drug, that is on the y-axis, right, that is on the y-axis. So this is what is your dose response curve. All right, so on the x-axis, like what do you have? It is the dose of the drug. And what is the one which is plotted on the y-axis? Remember, it is the effect, right, it is the effect which is produced by the drug, that is on the y-axis. Now remember another very important point here. This particular dose response curve, it consists of two components. All right, it consists of the two components. Now what are these particular two components here? Remember, one is your dose plasma concentration curve and the second one is the plasma concentration response curve, right. It consists of two components, right, and what are those two components is, one is dose plasma concentration curve, all right, dose plasma concentration curve, that is one, and the second one is plasma concentration response curve. Right, plasma concentration response curve, right. So these are the two components under your dose response curve. Now let me tell you one important point here. Remember, as the plasma concentration of the drug is more closely related to the response, the graph between the plasma concentration and the response is usually called as the dose response curve, right. So dose plasma concentration curve and plasma concentration response curve, these two together if you combine, we get what is called as dose response curve. So what is that? So plasma concentration, okay, the plasma concentration of the drug is more closely related to the response. So it is directly proportional to the response. So what does that mean? More is the concentration of the drug in the plasma, more will be the response, okay, and this response between the plasma concentration and the drug response, and this is called as the DRC, that is dose response curve. Now Now remember, there are two types of the dose response curves, right? This particular dose response curves, like you have two types, right? There are two types of dose response curve, and these can be described as these can be described as, one is Quantal, right? One is Quantal and the other one is graded, right? One is Quantal and the other one is graded. Now let me discuss about the Quantal dose response curve, right? What do you mean by Quantal dose response curve is when the response is an all or none phenomenon, right? When the response is an all or none phenomenon, then that is called as Quantal dose response curve. Okay, so when the response is when the response is based on when the response is all or none phenomenon, that is what is called as the Quantal response. I will tell you an example here, right? Let me tell you an example here. Remember, an antiemetic drug, right? Antiemetic drug stopping the vomiting or not, that will be your Quantal dose response curve. Okay, so so if you take the antiemetic drug stopping vomiting or not, that is what is your Quantal dose response curve. Okay, now the y-axis, that is the response axis, right? Y-axis is the effect, that is the response axis, that shows the number of persons responding, and the x-axis shows the dose, that is plasma concentration. Okay, the x-axis shows the dose or the plasma concentration, the y-axis shows the response. Right, the y-axis shows the response. Is that clear? So that is what is the Quantal dose response curve, right? When the response is all or none phenomenon, for example, the antiemetic drug stopping the vomiting or not, the y-axis that shows the person responding and the x-axis it shows the plasma concentration. Now this Quantal dose response curve is used to calculate, the two important phenomenon, that is ED50, right? It is used to calculate two important phenomenon, one is ED50 and the other one is the LD50. I will tell you what is this ED50 and as well as the LD50. Now you take this particular ED50 first and later on let me discuss about the LD50. Now what is this particular ED50? ED50 is nothing but median effective dose, right? So median effective dose, right? That is your ED50. Now you take LD50. LD50 is the median lethal dose. Right? LD50 is the median lethal dose. Okay. Now let me discuss in detail about the ED50 and as well as the LD50. Alright. So before going into the further part of the discussion, let me shortly revise here what we have discussed. If you take the dose response curve, it is actually the graph between the dose of the drug or the plasma concentration of the drug on the x-axis and as well as the effect which is being produced by the drug or the response of the drug on the y-axis. And there are two components in this dose response curve. One is dose plasma concentration curve and the other one is plasma concentration response curve. And plasma concentration of the drug is directly proportional to the response of the drug, and that is what is called as dose response curve. And this dose response curve right? Like we have the two effects, right? Two types of dose response curves are present. One is quantal and the other one is the graded, right? So two types of DRC can be explained. One is quantal and the other one is graded. Now you take quantal. Quantal dose response curve, when the drug is when the response is an all or none phenomenon, example, the anti-emetic drug stopping the vomiting or not, that will be quantal dose response curve. Whereas you take the graded dose response curve, let me discuss about that later. Now we have two important phenomena in the quantal dose response curve. One is ED50 and the other one is LD50. ED50 is the median effective dose and the LD50 is the median lethal dose. Now let me discuss about the what is called as ED50, right? ED50 is nothing but median effective dose. Okay, so alright, so median effective dose. So median effective dose, this is called as ED50. Now what does this mean? Remember, it is defined as the dose that will produce the half of the maximum response is what is called as the median effective dose, that is ED50. Okay, so dose, alright, dose that will produce, right, dose that will produce the half of, right, the dose that will produce the half of the maximum response. Right, the half of maximum response is called as the ED50. Now a point what you should remember here is, more is the ED50, lower is the potency of the drug, right? What does that mean? More is the ED50 means more is the requirement of the dose for producing 50% of the maximum response. So more dose is required means lesser will be the potency of the drug. So what I want to tell you here is, more is ED50, right, more is the ED50, lower is the potency, right, lower is the potency, whereas less is the ED50, right, less is the ED50, higher is the potency of the drug, right, higher is the potency of the drug. So that is what you mean by the median ED50, that is median effective dose 50. Next we have what is called as LD50. Now what does this LD50 stands for? That is lethal dose. Okay, so now let me discuss median lethal dose, right, let me discuss the median lethal dose, that is LD50. Right, that is LD50. Now if you take the median lethal dose, remember it is the dose that will result in death of 50% of animals receiving the drug, right? So it is the dose, right, it is the dose that will result in that will result in death, right, that will result in death of 50% of animals, right, that will result in death of the 50% of animals receiving the drug. That is what is called as your median lethal dose LD50. Now remember, more is your LD50, safer is the drug. What does that mean? That means for the drug to produce death in 50% of animals, you require more of its dose, and that safe will be your drug. So when the drug is given in large quantities, then it will produce 50% of the animals death. So more is the LD50, safer is the drug. That means if you give the drug in lesser quantities, it is very much safe. Okay, so more is LD50, safe is the drug. So that is what is called as the median lethal dose. Next, we have one more concept which is called as therapeutic index. Right, we have one more concept which is called as the therapeutic index. Now what do you mean by this word therapeutic index? Remember, therapeutic index is the one, it measures, or it is a measure of the safety of a drug. Right, it is a measure of the safety of a drug. Right, that is what is called as your therapeutic index. Now how is this particular therapeutic index calculated? Remember, it is calculated as a ratio of LD50 to ED50. Right, it is calculated as a ratio of LD50 to ED50. Right, next, now remember, drugs having high therapeutic index, they are safer. Right, the drugs having higher therapeutic index, that means when do you expect that the therapeutic index is high? When LD50 is high. Now what did we discuss? Where more is the LD50, safer is the drug. So if the ratio is high, so drugs having high therapeutic index are safer, whereas those having lower therapeutic index are more likely to be toxic. Okay, so drugs having high therapeutic index, they are considered to be safer. Right, they are considered to be safer, whereas those having low therapeutic index, right, those having low therapeutic index, they are more likely to be toxic. Right, they are more likely to be toxic. So that is what is your therapeutic index. So remember, what do you mean by median effective dose? ED50, dose that will produce the half of the maximum response. So more is the ED50, lower is the potency, less is the ED50, higher is the potency. And you take the median lethal dose 50, that is LD50, dose that will result in death of 50% of the animals receiving the drug. More is LD50, safe is the drug. And if you take therapeutic index, it is the measure of the safety of the drug, and it is calculated as a ratio of LD50 to ED50, and drugs having high therapeutic index are safer, whereas those having low therapeutic index are more likely to be toxic. Now let me discuss about the graded dose response curve. Right, graded dose response curve. So we have discussed that dose response curves will be in two forms, one is Quantal and the other one is the graded dose response curve. So already we have discussed about the Quantal dose response curve. Next let me discuss about the graded dose response curve. Here what will happen is, like, you take the response of the drug, right? When the response of the drug can be graded, I'll tell you an example for that. So when the response can be graded, then we call it as the graded dose response curve. Right, when the response is graded. Alright, when the response is graded, then we call it as the graded dose response curve. Now for example, you take the reduction in the blood pressure. Right, for example, you take the reduction in the blood pressure. Now let me show you a graphical representation here. Now for the graded response curve, you see here on y-axis and as well as the x-axis. And on the x-axis, like you have the drug concentration. Right? On the x-axis, you have the concentration of the drug in the form of log. Right? In the form of log. And on y-axis, you have the response. Right? On the y-axis, you have the response. Now, I'll tell you about two drugs here. Right? We have drug A. Right? We have drug A, and then we have drug B. Right? Drug A and as well as drug B. Okay. So let me discuss this particular graph and about the graded dose response curve. Now you see here on the x-axis we have drug concentration and on the y-axis you have the response. Now remember, the dose response curve, that is graded dose response curve, is usually an hyperbola. Alright, the dose response curve is usually hyperbola in shape. Now remember, as the curved lines, right, as the curved lines cannot give good mathematical comparisons, so usually the dose is converted into the log dose to form log DRC. I'll repeat again, as the curved lines, right, as the curved lines cannot give good mathematical comparisons, so usually the dose is converted to log dose to form log dose response curve, right? And this particular log dose response curve, it gives a sigmoid shaped curve. Okay, so remember the log dose response curve, right, it is a sigmoid shaped curve. Alright, it is a sigmoid shaped curve. Okay. So another advantage of converting it into logarithmic form is that large variation in doses can be plotted on the same curve, right? So a point you need to remember about the graded dose response curve is the response of the drug is graded, right? For example, the reduction in the blood pressure, right? For the antihypertensives, like we have many antihypertensive. One particular antihypertensive will cause a maximum fall in the blood pressure and the other antihypertensive will cause minimal fall in the blood pressure. So that is what is called as the response is being graded. Okay, and usually the dose response curve is hyperbola, but when you take it in the form of logarithmic form, that is log dose response curve, then it is a sigmoid shaped curve. Okay, now three important parameters can be determined from the dose response curve. Okay, so three important parameters. Right, so remember, three important parameters can be determined from the dose response curve. And what are those three important parameters is, one is potency, right, one is potency, and the other one is efficacy, right, the other one is efficacy, and the other one is the slope of the curve. Right, these are the three important parameters that can be determined from the dose response curve, that is potency, efficacy and slope of the curve. Now let me discuss about the potency. Right, let me discuss about the potency. Now what exactly you mean by the word potency is, remember, it is the measure of the amount of the drug needed to produce the response. That is what is called as your potency, right? So what is your potency? Remember, So it is the measure of amount of drug alright, it is the measure of the amount of drug needed to produce, right, needed to produce the response. Alright, so potency is the measure of the amount of drug needed to produce the response is called as potency. Now, a point what you need to remember here is drugs producing the same response at lower dose or they are more potent, whereas those requiring large dose they are less potent. Okay, so what you need to remember is drugs producing the same response alright, drugs producing the same response at lower dose, right, drugs producing the same response at lower dose they are more potent, right, they are considered to be more potent, whereas those requiring larger dose, right, whereas those requiring larger dose, remember they are less potent, right, remember they are less potent. Alright, next, the other point what you need to remember is in the dose response curve, more a drug is on the left side of the graph, higher is its potency, right. So this is your dose response curve, right. Now more left side of the graph is the drug. More left side means what? The concentration of the drug which is required is less and the response is same. So in the dose response curve, more a drug is on the left side of the graph, higher is its potency and vice versa. Alright. So if you take drug, this you consider it as drug A and you consider this as to be drug B. Now you take the comparison between drug A and drug B, which is more potent. Remember, drug A is more potent compared to drug B. Okay, so in the dose response curve, remember, more a drug is on the left side of the graph, higher is its potency and vice versa. And if you compare these two drugs, that is A and B, drug A is more potent than drug B. Alright, so that is about the potency. Now let me discuss about the second parameter, that is efficacy, right. Let me discuss about the second parameter, that is efficacy. Now what do you mean by the word efficacy? Remember, it is the maximum effect produced by a drug, that is called as efficacy. Okay, so the word efficacy means maximum effect, right, maximum effect produced by a drug. Right, maximum effect produced by a drug, that is what is called as your efficacy, right. And a point what you should remember is more the peak of the curve, greater is the efficacy, right. More is the peak of the curve. What do you mean by the word more is the peak? That means more is the response, right, more is the response. So more the peak of the curve, greater is the response. Right, more is the peak, more is the peak, greater is the response, right, or greater is your efficacy. Now remember, it is clinically more important than potency, right. If you compare efficacy and as well as potency, which is more important? The efficacy is more important than the potency. What does the potency tells you? Potency tells you it is the maximum effect produced by a drug. Is that clear? Now, after having discussed about the potency and efficacy, let me discuss about the third parameter, that is slope. Now, before going into further discussion, let me shortly revise here. If you take the graded dose response curve, here what it tells is the response is graded, right? Now for example, you take the antihypertensive drugs, right? The reduction in the blood pressure, a group of antihypertensives will cause maximum reduction in the blood pressure, the other group of antihypertensives, they cause minimal reduction in the blood pressure. So the response is graded, alright. Now the other point what you should remember here is, now on the y-axis we have the response and on the x-axis we have the drug concentration, and I have given you the graphs of two, that is A and as well as B. Now let me discuss about this particular graph. Usually the dose response curve is usually hyperbola in shape, but as curved lines cannot give good mathematical comparison, so usually the dose is converted to log dose to form the log dose response curve. This log dose response curve, it gives a sigmoid shaped curve, right? And another advantage of converting it into logarithmic form is that large variation in doses can be plotted on the same curve, and three important parameters can be determined from the dose response curve, that is potency, efficacy and as well as the slope of the curve. You take the potency. Potency, if you see, it is the measure of the amount of a drug needed to produce the response. Now drugs producing the same response at lower dose, they are considered to be more potent, whereas those requiring large dose, they are less potent. Next, in dose response curve, more a drug is on the left side of the graph, higher is its potency and vice versa. Now you take about the word efficacy. Now if you see this efficacy, what does that mean? It is the maximum effect produced by a drug, right? More the peak of the curve, greater is its efficacy. And remember, efficacy, it is clinically more important than potency. Now let me discuss about the slope of the curve. Right, let me discuss about the slope of the curve. So like we have discussed that, like there is potency, there is efficacy and there is slope. So we have discussed about the potency and efficacy. Now let me take up the slope. Now what is that particular graph, like what we have? One is the dose or the concentration of the drug on the x-axis, and then on y-axis, like what we have is the response. Right, on y-axis, like what we have is the response. Now so like you take, we have a drug A and then we have drug B, right, and we also have a drug C. Okay, now remember, if the dose response curve is steeper, right, for example you take the drug A, okay, you take drug A. If you compare these three drugs, that is A, B and as well as C, which drug has more steeper dose response curve? The drug A, it has more steeper dose response curve. So what I want to tell you here is, if the dose response curve is steeper, that means the response will increase dramatically with slight increase in the dose, right? You just increase the dose minimally, right? You will have a dramatic response. That is what you mean by if the dose response curve is steeper. So a point what you should remember is, if the dose response curve is steeper, alright, if the dose response curve is steeper, that means, right, that means the response will increase dramatically, right? That means the response will increase dramatically with slight increase in the dose. Right? Response will increase dramatically with slight increase in the dose. Now, next point you see. Thus, remember, drugs having steeper dose response curve, they have narrow therapeutic index, whereas the drugs having less steep curve, they have lesser or lower therapeutic index. Okay, so what I want to tell you here is drugs having steeper dose response curve, they have narrow therapeutic index, right? They have narrow therapeutic index. And what are those examples of those particular drugs which are having narrow therapeutic index and steeper dose response curve? Example is your barbiturates. Right, example is your barbiturates. Whereas the drugs having less steep curve, right, the drugs having less steep curve are, the examples is the benzodiazepines, right? So if you take the less steep curve, the examples what you have is benzodiazepines. Right? So remember, barbiturates, they have very steeper dose response curve, narrow therapeutic index, and less steep curve is there for the benzodiazepines. Now, let me tell you another important point. Dose response curve can also be utilized to know whether a drug is a competitive or a non-competitive inhibitor. Right? The dose response curve is also utilized to know whether the drug is a competitive inhibitor, right? Whether the drug is a competitive inhibitor or non-competitive inhibitor. Right, the dose response curve can also be utilized to know whether a drug is a competitive or a non-competitive inhibitor. Now, let me take up competitive inhibitor and later on let me move on to the non-competitive inhibitor. So first, if you see, in case of competitive inhibitor, the curve will shift to the right. That is, okay, let me tell you here. Remember, in case of competitive inhibitor, the curve will shift to right. Right, the curve will shift to right. That is, now what is this competitive inhibitor first? Now you have an agonist and you have an antagonist. Now what is an agonist? Agonist is the one which, if it binds with the receptor, it will show a positive response. That is agonist. Now what does the antagonist will do? If antagonist will go and bind with the receptor, that will neutralize the response which is being caused by the agonist. That is what is your antagonist. Now, in case of competitive inhibitor, the curve will shift to right. Right, the curve will shift to right. What does that mean? That is, now the same agonist will have less potency in the presence of antagonist. What the antagonist will do? Antagonist will neutralize the effect of agonist. Now what type of antagonist is it here? It is a competitive antagonist. That means here, in case of competitive inhibitor, the antagonist will compete with the agonist for the same receptor. That is the reason why agonist will have less potency in the presence of antagonist. Okay, so the curve will shift to right. That is, now, right, that is, now the same agonist right, the same agonist will have, right, will have less potency, right, will have less potency in the presence of antagonist. Alright, will have less potency in the presence of antagonist. So what I want to tell you here is the agonist in the presence of antagonist, the dose required is more to produce the response. That is the reason why in the presence of a competitive inhibitor, the curve will shift to the right. Alright, next, let me tell you another important point. In case of competitive inhibitor, it does not, right, it does not affect the efficacy. Right, it does not affect the efficacy of the drug. Right, what do you mean by the word efficacy? Efficacy is the maximum effect which is being produced by the drug. So in case of competitive inhibitor, the agonist efficacy will not affect, but what is the antagonist doing? Antagonist is trying to compete with the agonist. That is the reason why the dosage of the agonist increases to produce the same effect. That is the reason why the graph will shift to the right. Alright, now you take in case of non-competitive inhibitor. Right, in case of non-competitive inhibitor, there will be flattening of the dose response curve. That is, there the efficacy decreases here. Okay, so what I want to tell you here is, in case of the non-competitive inhibitor, there is flattening of dose response curve. Now what do you mean by the word non-competitive inhibitor? Non-competitive inhibitor, that means it is an irreversible inhibition. Here in non-competitive inhibitor, there will be flattening of the dose response curve. Whereas, so what does that mean? This means that the efficacy decreases. Right, this means that the efficacy decreases. Alright, and remember, it usually does not affect the potency. Right, this particular non-competitive inhibitor, it does not affect the potency. Alright, it does not affect the potency. Now, if the antagonist is irreversible competitive, then there will be decrease in potency as well as efficacy. So remember, in case of competitive inhibition, it does not affect the efficacy of the drug. Whereas in case of non-competitive inhibition, the efficacy is decreased, but it does not affect the potency. But a point what you should remember is, in case of, right, if the antagonist, if it is a irreversible competitive antagonist, there will be decrease in both potency and as well as the efficacy. Okay, so right, if the antagonist is irreversible competitive, right, if the antagonist is irreversible competitive, there will be decrease in, right, there will be decrease in potency as well as efficacy. Right, there will be decrease in potency and as well as the efficacy. So this is what you mean by the slope of the curve. Right, let me shortly revise about the slope of the curve. Remember, if the dose response curve is steeper, that means the response will increase dramatically with slight increase in the dose. And the point is, the drugs having steeper dose response curve have narrow therapeutic index like barbiturates. Then those having less steep curve, for example like benzodiazepines. And you take the dose response curve. can also be utilized to know whether a drug is competitive or non-competitive inhibitor. In case of the competitive inhibitor, the curve will shift to right, that is, now the same agonist will have less potency in the presence of antagonist, and this competitive inhibitor, it does not affect the efficacy of the drug. Next, in case of the non-competitive inhibitor, there will be flattening of dose response curve, that is, the efficacy decreases. Next, remember, it usually does not affect the potency. If the antagonist is irreversible competitive, there will be decrease in potency as well as the efficacy. So this is about the discussion on what is called as the graded dose response curve, right? Dose response curve we have discussed as quantal and graded. So this completes the discussion on the dose response curve.